Today we're going to be doing the cold plasma treatment on Kira. Kira has already had 3 treatments. This is going to be her 4th cold plasma treatment. One of the treatments was combined with Aquashore, so she did receive an aqua peel with the cold plasma, and it's been about a week later. So we're going to be starting or continuing on with her series. So as you can see, I'm going to start on her neck, and we're going to do a level 5. We are not pressing into the skin. We are going to gently glide the device over the skin, and the skin has to be completely dry. We're doing about 10 passes per area, so that way we are creating the correct reactive oxygen and nitrogen species to interact with the skin cells. How does it feel?
Good, kind of just like high frequency a little bit.
A lot of clients will say that same thing. They'll feel typically how you would feel with high frequency, and they might have that ozone smell accompanying the treatment. So it's totally okay, because the skin is dry and there's no glide, for the device to skip a little bit. Sometimes we think we need to apply more pressure, but it's actually a case of holding the skin a little bit more taut and applying a little less pressure. We're going to focus, because this is a standalone treatment, we are going to focus the cold plasma device on one side of the face first, and then we will go to the other side. The great thing about cold plasma in this handpiece is it actually has a countdown for you. So it will actually time the service for you so that you don't have to keep track. So if you're doing a standalone treatment, if somebody has, say, acne, or if somebody has pigment like melasma and you want to do some standalone treatments, you can do a full face and neck in 20 minutes by splitting the face up into 2 10-minute sessions. You can always check in with your clients, see how they're feeling. If the device is really skipping on the skin, you can feel free to change the directions of your passes if needed. Once we get to the orbital bone, some clients may feel a little bit more sensitive, so that could be your indicator to turn the dial down. And remember, the device has a ceramic headpiece, and the skin should be touching the ceramic part. Because we need the air to react above the skin, there's about 1 millimeter space where the energy or the electricity is delivering the plasma. If you need to, you can always go in smaller sections. I'm going to come down to this chin area, and I'm going to go from the chin to the marionette. And again, if you need to, you can always hold the skin taut. If you have clients with more laxity or less elasticity, you can hold the skin taut and work in smaller sections. There are multiple size tips that are included with your device. And if you'd like, you can always do the regular size tip, which is on the device right now. And then at the very end of the treatment, you can go in and do detail work with the smaller tip. And the smaller tip is great around the eyes and around the orbital bone, as well as around your mouth. You can also use the smaller tip on the nose, but right here we're going to actually use the larger tip. You can check in with your client, see how they are feeling at a level 5 intensity, which is the highest. How are you doing?
Good, yeah, it feels the same as before, just like high frequency.
I'm gonna go under the eye. And again, if you need to, you can turn your client's head and you can work in smaller sections if that's an easier way for you. So we have about 4 minutes left for this side. So you can go right over the orbital bone as well as the eyebrow. And again, cold plasma really does cause the skin cells to act healthier. So there's evidence showing it can also help with hair growth as well. How's that feel on the eye? Is it okay?
Yeah.
We're gonna move to the other side. There's about 2 minutes left on the wand. It will reset after the 10-minute mark, and that's completely okay. We'll just restart it. The other thing that we're gonna do at the very end of treatment, like we said, is to go back and potentially work with the smaller tip. So it's okay if we get started with the larger tip, even if there's 2 minutes left, because we'll have that detail work at the end. How's that feel? Is that okay?
Mm-hmm.
The pen just restarted, so we're gonna go ahead and do another 10 minutes. You can customize this treatment anywhere from 10 to 20 minutes, so it's versatile and you can add it into a lot of other services. It's a great complementary treatment to dermaplaning or chemical peels or any type of dermabrasion machines that you might have. Depending on the client's skin type, you can do it before or after enzymes, and you can also do it before or after peels, just depending on the strength of the peel and the different skin texture and conditions of your client. When you're working on the upper eyelid, you can hold the skin a little bit taut, so that way you can access skin that normally sits at or a little bit under the orbital bone. You don't want to go onto the eyelid, but you do want to access the skin that is on the orbital bone. So now we're going to go ahead and switch the tip. So this is the regular size tip. And we are going to now switch it to the smaller tip and do detail finishing work. With the smaller tip, because the energy is being delivered in a smaller circumference or smaller area, some clients may feel more intensity. So you will want to check in with your client. You may want to turn it down to a 4 instead of a 5, and then check in with your client to see how they're doing. So Kira, as I'm working, let me know if it's comfortable or if you need me to turn down the intensity. Right now we are at a 4, and I'm gonna go back over a few areas just to make sure I'm really getting the area of concern. How's that feel?
Good, it's definitely stronger, but like I don't feel like
Tolerable?
you need to turn it down, yeah.
So this is also a great size for the upper lip, so you can always hold the skin a little bit taut. Again, the upper lip can be sensitive, but very tolerable. So I'm gonna do one pass and just see how Kira's doing. Is that okay?
Yep.
And I'm going to stay in this area and go on the other side and do her upper lip. We're also going to come down to her chin and do a little bit of extra detail work in that area. We can come and do the under eye area, so you can pull the skin taut downward and you can really work on the orbital bone. So again, because the energy is kind of in a smaller concentrated tip, you may find you want to turn it down on the eye area or the upper lip. You can also do more detail work on the nose. So you can really get on the side of the nose really well with the smaller tip. And how is that intensity?
Good.
Come on the other side. You can also do the bridge of the nose and the glabella between the eyebrows. So we're just about done. So I'm going to turn the device off. And remember, cold plasma does increase permeability of the skin by about 24%. So whatever we're putting on after the skin is going to absorb a lot better. So I'm going to put on our growth factor serum. And I'm also going to put on our balancing barrier cream with our SPF afterwards if it's a daytime appointment. If it's a nighttime appointment, you don't have to obviously put SPF on. And remind the client that their skin is permeable for that day, so they should avoid using any actives or any products that you didn't discuss directly with them. So things like peptides are awesome after this. Growth factors are fantastic. If you have hydrating sheet masks, that's another great option to combine with cold plasma. Avoid very active ingredients unless you know their skin can tolerate it well. And then she'll come back in another week for her 5th treatment.